Epidemiology and Outcomes of Pediatric Staphylococcus aureus, a pediatric investigators collaborative network on infections in Canada study, with PI Dr. Jesse Papenburg from McGill University and the PI at Alberta Children's Hospital being Dr. Karsten Kruger, with Morgan Mazurek as a fellow researcher from the Cummings School of Medicine. Staphylococcus aureus is a bacteria that lives on the skin. The skin acts as a barrier, preventing the invasion of bacteria into deeper tissue. When this barrier is disrupted, S. aureus can invade and cause infection. Staphylococcus aureus Bacteremia, or SAB, occurs when the bacteria enters the bloodstream and replicates. The toxins they produce and the immune system's response to the bacteria disrupt the delicate balance of body processes, causing a serious illness called sepsis. Sepsis is a leading cause of death worldwide. In comparison to adults, there is a dearth of evidence for SAB prognostication and treatment in children. As a result, evidence from studies of adults with SAB are used to manage children with SAB out of necessity. However, there are key medical differences between children and adults that limits the generalizability of these studies. Children with SAB experience different mortality and morbidity compared to adults, influencing the treatments they may need to receive. Addressing this knowledge gap is crucial in ensuring children with SAB are treated appropriately. Through the form of a retrospective cohort study, in which the medical records of children admitted to hospital will be reviewed, two objectives will be fulfilled. This study will describe the frequency, epidemiology, and outcomes of SAB in pediatric patients, as well as identify the risk factors that lead to severe outcomes. Consequently, predictors of poor clinical outcomes, the most effective antibiotic treatments, and methods of infection source control will be identified. Addressing these gaps in pediatric medical literature will help improve the management of children with SAB and improve their clinical outcomes. For methodology, the medical records of children admitted to the Alberta Children's Hospital with SAB between 2019 and 2023 will be reviewed. Information about each patient's demographics, health conditions, medical management, and outcomes will be collected and inputted into a standardized case report form, or CRF. Statistical software will then be used to describe the group of patients and analyze the data on the CRF, aiming to identify children at risk for severe outcomes and the treatment options leading to best outcomes. The results of our analyses are expected to provide pediatricians with more information to guide the antibiotic management, necessity of surgeries, and counseling of families whose children have risk factors for severe infection or death. Consequently, the outcomes of children with SAB will be improved and a gap of pediatric research will be filled. 3 types of analyses will be used in the study. A univariate analysis will be used to associate risk factors with 30-day mortality. The clinically relevant variables and variables with significant association to severe outcomes will be used in a follow-up multivariate analysis to adjust for potential confounders. To assess time to mortality within 30 days, a Kaplan-Meier survival analysis will be used. This research is a part of the Pediatric Investigators Collaborative Network on Infections in Canada, or PICNIC, a nationwide initiative to understand the pathogenesis, treatment, and prevention of pediatric infectious diseases. Through the collaborative efforts of PICNIC, hospitals across Canada are conducting similar research to procure a large sample size and accurate data of children with SAB. This joint research effort will improve outcomes for children with SAB, addressing a significant gap in pediatric research. Featured on screen are the references utilized in this video. Thank you so much for watching.